So at the outset, I would like to thank the organizers for giving me an opportunity to speak. Not a very easy topic. I'm going to speak to you all on understanding anxiety, fear, and panic. So, it's not very easy speaking about anxiety and fear over 15 minutes. I've tried to simplify it for you all as much as possible. I've tried to use like layperson's language. If at any point of time, I've used a lot of technical terms, I apologize. But still, I've tried to make it as crystal clear as possible for you all. So there are like two facets to this photograph, and I have actually taken this photograph. What we see in this photograph are like two sets of emotions. On one side, we know that day where everybody cried. I think half of India cried. We all thought that the World Cup was already there for us. We ran with the team. We went everywhere with the team. And I don't think anybody was more disappointed than those like 11 players on the field. And then there's the second set of emotions where we ran with them, we sang with them, we were happy, we waited for them in the airport. These are nothing but emotions, like natural expressions that we see. On one side, we see grief and sadness. On the other side, we see happiness and joy. Okay? So these are basic emotions that we feel. There's also a back end to the story which I'm going to show you all like later. So just remember this picture. So what exactly are emotions? So emotions are a complex physiological state. Basically it's a complex psychological state. It involves subjective experiences, physiological responses, and behavioral reactions. This is always in response to events or stimuli. These are usually variable and these are usually like dynamic. So it varies from person to person. So your emotion may be slightly different from another person's emotion. So we all have certain basic kinds of emotion: happiness, sadness, fear, disgust, anger, and surprise. These are some of the basic emotions that we have. So when we look at the brain per se, we have three parts of the brain. When we look at it from an evolutionary perspective, we have basically the brainstem, which is responsible for the basic functioning of the brain. So it's responsible for your respiration, your swallowing, your cardiac center, etc. Then we have the limbic system. The limbic system is the emotional brain. That's the one which is responsible for your feelings, And then we have the cerebral cortex, which is the thinking part. Humans have evolved over a period of time, and it is the cortex which actually is the final control of our brain. So when we look at the limbic system, our focus today is going to be on the limbic system. The limbic system is a very, very, very small network in the brain, but it's extremely complicated when you look at it. It actually controls all the emotions, all the feelings, etc. So when you look at it, it's actually very complicated. The circuits are very complicated. But remember four things. You have the amygdala, which is the superhero or the protector. So basically that's the captain, That's basically the prime minister of the country, or that's the captain of your team. Then you have the hippocampus, which is the librarian, which remembers all your memories, your happy memories, your painful memories, etc. That's the hippocampus. It always retrieves it back from the memory. Then we have the cortex, which I've called as tex, which is the problem solver. That's the one which thinks and that actually regulates your responses. That's the one which decides whether you should keep shouting and screaming, whether you should run away, etc. And finally, you have the hypothalamus, which is the enforcer. So hypothalamus actually releases all the neurochemicals, the hormones, etc. And then it causes all the reactions that you have. Okay? So these are the four important aspects of the limbic system. It's not as simple. It is the most complicated network in the brain. So when we look at two basic emotions that we have, the first one is anxiety and the second one is fear. These are basically defense mechanisms. They are protective in nature. So all of us are allowed to have some amount of fear and anxiety. Like for example, if I had to come in front of you all, I had a little bit of anxiety. I'm facing 150 women for the first time in my life, So there's a lot of anxiety, So that's normal. As soon as you come back to normal, everything goes away. You stand on the stage, it goes off. That's a normal sort of an anxiety that you have. But if it affects your quality of life, if, for example, I see all of you all and I had to hide under this bench, that's abnormal. That's stage fear. So these are basic emotions, but they have a role. If you look at it evolutionary, we've always had threats. We've had historical threats. We also have social threats at this point of time. Historically, we've had wild animals which have hunted for us. Historically, we've had tribesmen. We've had wars. So anxiety and fear have played a role in being a protective mechanism. Imagine if you had no anxiety, you would be just running off a cliff. Imagine if you had no anxiety, you would be falling off the road, you would be just crossing the road without being careful. So it's actually a protective mechanism. It works like a defense mechanism. Only thing is, see, the threats have always been there. It's just that the nature of the threats have changed. Earlier we had animals, actual wild animals. Now we have animals in human form who are threats now to us, So that's one thing. So we have people who scream at us, who bully us. We have people who speak behind our back. So all these are social threats which all lead to anxiety and fear. Now, this is very important for you all. So we started with emotion, and then we broke down emotion into two parts, anxiety and fear. So remember one thing, anxiety, fear and panic are not one and the same. They are three different terms. We use it interchangeably, but that's not one and the same. Anxiety is basically an expression of the defense mechanism to cope with a situation. So it's like a sense of unease. It's like how I said, I'm going to come in front of you all and I have a little bit of uneasiness. I'm not sure how I'm going to perform here. Okay. Fear is when you face a potentially dangerous stimulus. So that means if you see fire or if you see somebody who's going to kidnap you, so that's fear. That's real fear. And panic is basically a psychological problem. So basically it's a physical response and you perceive the threat to survival. So you imagine things out there. The first one was me before the presentation, trying to hide under the chair. So that was anxiety. The second one is a kid out here. She sees the dog as a threat. So she's got fear of the dog. The third one is a young lady, bright young lady walking on the streets, and she suddenly sees a lot of people. She gets extremely claustrophobic and then she gets a panic attack. And I would also like to say that, the gentleman who did the dance showed a very, very good expression of the panic attack that somebody has, If you look at the anatomy of a panic attack, people have things like, they have 1 billion thoughts over their head. A hippopotamus or an elephant is sitting on their chest, the hands are cold and clammy, they are frozen, the stomach feels squeezy, etc. You forget blinking, you're just staring out there, you don't know what's happening. So this is the usual anatomy of a panic attack. So again, this is very important. What is the difference between fear and anxiety? Fear is a basic emotion. Anxiety is a state of mind. Again, fear is usually brief or discrete. Anxiety is long and chronic. Again, fear is a response to imminent threat. Anxiety is a response to future threat. Basically, it's you're overthinking about these things. In fear, you have intense autonomic arousal, so you have a lot of salivation, cold, clammy extremities, etc. And in fear, you have more of visual processing, so you imagine things in fear, whereas in anxiety, you have verbal processing and you keep thinking about things. What is the difference between panic attacks and anxiety attacks? So anxiety attacks can keep on, they get propagated and then it goes into a panic attack. So in a panic attack, it starts all of a sudden, you have intense physical symptoms, you have fear of losing control, fear of dying. It usually lasts for a short duration and it can happen without any cause. In both you have shortness of breath, sweating, nausea, etc. Anxiety attacks I've already spoken about. They usually develop slowly over a period of time and you have a feeling of unease and you have some physical symptoms of them and last for a long period of time. What is stress? Now stress response, we all go through a normal stress response. So whenever we face stress, we have the amygdala which I spoke, Amy, the superhero or the captain of the ship, that sends signals to the hypothalamus and the hypothalamus stimulates the autonomic nervous system of our body and that initiates the fight or flight response. And once the threat is over, then the body goes back to the normal state prior to the threat. So basically this is a stress reaction. We all can face stress. You're driving on the road and somebody comes in front of you. That's a stressful situation for you all. So, but if stress gets propagated again and again, you go into chronic stressful condition and that leads to other problems. This is what fear does to your body. So fear is like you see something which looks like a snake or a stick. It again goes straight to the amygdala, and the amygdala is the one now which has to control the entire thing. So it sends signals to the sensory cortex, the thalamus, the hippocampus. It tries to retrieve things from the old memory. It sends signals to the cortex, tries to find out how to regulate the response. And after all this happens in a few seconds. It then sends the signals to the hypothalamus, and the hypothalamus works via the pituitary and the adrenals to actually take an action. So that's where we call as the fight or flight phenomenon. So we have freezing, fleeing, fighting, change of facial expression, stress hormones. That's why you can smell fear. You can smell fear. If somebody is having fear, you can smell that sweat, you can smell that fear. You can see the fear, you can see the expression on their face. You can see them verbalize the fear, their hands, they may be actually quivering. So you can smell fear, you can see fear, you can hear fear. So it's always possible. And all this happens because of a complex processing which happens inside the brain. Now, what happens if you keep on having stress over and over again? So you have to realize that stress and anxiety, if it keeps happening again and again, it actually goes into an inflammatory state. It's actually inflammatory for the brain. So what happens is when it keeps on happening, this cycle keeps on repeating, this leads to long-term cognitive, emotional and health effects. So initially you're hypervigilant, you have sensitivity to pain, you have social anxiety, and then it causes chronic problems like sleep disruption, chronic pain, social withdrawal, depressed mood, and then long-term it impairs your immunity and it leads to inflammatory diseases, even like diseases like autoimmune disorders like rheumatoid arthritis, multiple sclerosis, etc. are more common. Accelerated aging. You can see people who are under chronic stress, suddenly the hairs become very gray, the skin starts sagging, also associated with early mortality. So, as I said, in anxiety and fear, we have physical symptoms, faster heartbeat, feeling lightheaded, headaches, chest pains, loss of appetite, sweating, breathlessness. You have shaking as well as feeling hot. Then you have mental symptoms. You are unable to relax, you feel very tensed, you feel tearful, you have a lot of difficulty concentrating, you feel that the worst is going to happen to you, intrusive thoughts and obsessive thoughts. And then there are long-term changes in behavior. So you are not able to enjoy your leisure time. You can't look after yourself. Your grooming goes for a toss. You struggle to form or maintain relationships. You're worried about new things. You avoid places, situations. And you also have compulsive behavior. If you're angry with somebody, you're always checking your mobile phone. You're checking your WhatsApp. You're checking your social media. You're keeping on checking that and you're seeing what have I done wrong? Where have I gone wrong? How do I correct it all the time? I always tell this, some people are prone to get anxiety, some people, so it's a loaded gun, genetics loads the gun, lifestyle pulls the trigger. Remember this over and over again. So anxiety, panic, it starts in early childhood. Maybe your parents were very strict, you would have had some separation anxiety. In your teenage years, you would have had social pressures. In young adulthood, you would have had a breakup or you would have had academic pressures. And in adulthood, you would have had other problems with your kids, your husband, etc. So all this gets propagated over a period of time. So it's not something which starts in a single day. So you have to identify where things went wrong and try and correct it. There is this loop. Your behavior is usually guided by your thoughts and your feelings. But inside you have your core beliefs and you also have yourself and you have what others think about you and you're constantly worried about the future. That's where a lot of people keep on thinking, I can't do this, and only very few can think that I can do this. So basically it's because of your behavior being actually guided by the thoughts and the feelings. So this is the next part which I would like to speak about. This is fear of failure. So what we actually speak about fear for entrepreneurs is mainly fear of failure. So what is fear of failure? So fear of failure is also called as phobia. It's a phobia, that's it. So basically it's an avoidance of challenging situation where one experiences anxiety, stress and self-doubt. You have a reluctance to take risk or pursue goals, and it may manifest as perfectionism or a fear of judgment. This will keep on coming. People who are perfectionists have fear of failure. So if any of you have OCD about perfection, be very clear that, you can have like failure. That is one of the causes. There's also low self-esteem and like low self-confidence. They keep procrastinating. A lot of them keep procrastinating. There's negative self-talk and self-doubt. They have a difficulty in like making decisions and fear of judgment or criticism from others. There's also social withdrawal and other physical symptoms. So what is the cause? So the first cause are the past negative experiences or traumatic events. So if you've had any traumatic event in the past, somebody has told you, you cannot do this, you're going to fail. That's actually setting you on the road to failure. So first you need to identify that. High expectations. Sometimes we set unrealistic expectations. We want to scale too fast. Perfectionism. Again, that word would keep coming again. Lack of self-confidence. Also, there's a cultural and societal influence on success and failures. So, for example, as women, sometimes you're working in a male-oriented company. You may be actually be told by people that no, you're not going to succeed. We have not seen women CEOs succeed. Or if you're a male working in a woman-oriented company, you would be saying, no, this is a job for women, not a job for males. So there's also a societal influence on that. Then also personal beliefs, self-righteousness. Sometimes we are very self-righteous and self-idealistic. We think that we do everything right, he's doing everything wrong, and still he's getting all the credit, or she's getting all the credit, and she's getting all the business. Another problem we face, especially in our country, is overprotective or a critical upbringing. We see that all the time. Our parents have been overprotective, critical. They've always told us that you should do this, you should do that, this is the only way ahead. That actually is like setting you on the road to failure. Comparisons with others, Sharmaji's daughter is always better than my daughter, that comparison always is made, so that remember that. And lack of support and encouragement, because if you want to take risks and people are not ready to encourage you, then you're like setting yourself up for failure. So what are the complications of fear of failure? Procrastination, self-doubt, anxiety, low self-esteem, perfectionism, avoidance behavior, lack of personal growth, relationship issues, depression, and isolation. So how do you diagnose this? So it's basically by a clinical interview. You actually sit down and you try to discuss the symptoms, the fears, and personal history. You assess the anxiety levels and you see how it's impacting the activities of daily living. Also, you evaluate the avoidance behavior and look for patterns of perfectionism. You also have to have a discussion regarding the past experiences and triggers related to fear of failure. And you also need to rule out other anxiety disorders and phobias, and you need to collaborate with the mental health professional for an accurate diagnosis. So once you diagnose this, you have like various ways you can treat. You have cognitive behavioral therapy, you have exposure therapy, which helps, you gradually expose somebody who's got phobias and, to other situations in order to build resilience, relaxation techniques, mindfulness. You set realistic goals, break down into smaller tasks, seek support. If all these fail, only then go for antidepressant medications. Are we clear? Yeah? So that's the first thing we need to realize. There's a lot of abuse of medications in the market. Everybody wants to go to a psychiatrist and start medications, And I keep telling this all the time that we shouldn't be doing this. This is not right, because we are setting them, they're going to be like dependent on medications. Lifestyle is the key. So diet, sleep, and exercise. So there's something called as a mind dash diet, which helps to prevent the neurodegenerative disorders. There's also a diet rich in magnesium, zinc, etc., which you could take. Whole grains. Sleep is very important. All of you all who say like 4 hours of sleep, 3 hours of sleep, 2 hours of sleep, you all are going to face problems like Alzheimer's disease and Parkinson's later on. Okay? Because sleep is the garbage truck of the brain. It's in sleep that all the proteins which cause the diseases are cleared. That's known as the glymphatics. You can Google glymphatics. And I actually keep telling this. Most of the people come to me saying we have headaches and we're not able to concentrate. Most of them are looking at their social media at like 10 o'clock, 11 o'clock, 12 o'clock at night. It increases your incidence of headaches and other problems, language problems, attention, etc. And exercise. There's nothing that replaces very good exercise. Cardio, running, jogging, swimming, cycling. You need to hit that road. Yeah? So I wanted to show you the difference between stress, anxiety, fear, panic and fear of failure. So stress is your boss calls you up and says that you have an assignment to do. That's stress. Anxiety is boss calls you up, he says you have something to do and he gives you a deadline and you are slightly anxious about it. Okay? Fear sets in if your boss calls you up, says you have something to do, he gives you a deadline and he says you will lose your job if you don't do this. That's fear. And fear, and like panic is if your boss calls you up, asks you to do something, and you're not doing anything, you're enjoying your life, but just closer to the deadline, you suddenly realize you've not done anything, and now you're going to get a bad panic attack. So you fail after all this, and then you go on the road to fear of failure. So that's one thing. So you need to understand the chronology. So you have something called as an anxiety cycle, where you have a misinterpretation of a threat, you have anxiety, safety-seeking behavior. So this is where everybody goes into problem. They go into drinking, smoking, drug abuse, they go into compulsive shopping, or like eating cakes and pastries all the time. So, and then it gives you a temporary relief from anxiety, and you don't have a corrective experience. And you go into that same loop, which is a reinforced pattern. So again, the fear stimulus comes back and this keeps repeating, and that leads to all your chronic diseases like depression, panic, etc. So the second facet. So I told you, so we started with the first facet, the second facet. Until 2023, the Indian team had fear of failure. We never won a World Cup for almost like 10 years, and they would not say it. Trust me, they would not say it, but as a neurologist, I can see it. Those 15 minutes of foolishness they used to call, or the 45 minutes of foolishness, cold clammy hands, always making mistakes at the right, at the wrong time. And once they broke that fear of failure, you can see the results. They've won 2 trophies in a row. So you need to unshackle yourself from that fear of failure. You need to identify the processes which are causing the fear of failure, change what happens. They have changed. A lot of things have changed. If we go into that in like great detail, and sport actually teaches us a lot about fear of failure. Sport is full of all these stories. So, I hope I've educated you all about anxiety, fear, panic, and fear of failure. I just want to tell you, I just want to end with a quote by like Emerson, who said that fear has defeated more people in this world than all the diseases, all the wars put together. So you need to overcome your fears, and I'm sure all of you all would succeed. Thank you again, and I hope I was able to educate you all about the disease. Thank you. Adi Lakshmi.